I am excited to be able to start today's webinar, and I love to welcome the audience and thank you so much for taking the time to join us today. My name is Kelly O'Brien, and I lead both the Alliance for Regional Development and the Chicago Central Area Committee. If you're not familiar with our organizations, the Alliance was created in 2012 following a publication by the world's leading think tank on economic development. And it concluded that the Milwaukee, Chicagoland, Northwest Indiana corridor operate as an economic unit, and that all three states would benefit by having more cross-jurisdictional collaboration. And in response to that, stakeholders from Illinois, Indiana, and Wisconsin came together and created the Alliance for Regional Development. One of the founders is also the chairman of the Chicago Central Area Committee, which is a 64-year-old civic group focused on the planning and development of Chicago. So we're very honored to have great members and terrific stakeholders involved, both from the city perspective as well as from a tri-state region. We have the webinar series started right really when people stopped being able to go out to meetings, and we wanted to be able to continue to communicate. So we started the webinars. As in fact, I'm so happy to be welcoming back Dr. Suzet McKinney, as she was the first speaker back in late March, early April. And on June 1st, we rebranded the webinar series, and it's now called Disruption, Driving Innovation, and Embracing Economic Change. And that happens to also be the tagline for this year's 2020 Summit, which we're hosting again in partnership with the Federal Reserve Bank of Chicago. Please watch your emails for more details on that. So today, I know we have a great response for people that want to ask questions and understand kind of where we're at and where we might be going and why things are the way that they are. So for your questions, please use the Q&A button, and I will do my best to relay those questions to both the Deputy Governor as well as Dr. McKinney. And so, ladies, welcome. We did share your bios with the email invitation, but very quickly, for a quick reminder for our audience, Sol Flores is the Deputy Governor in J.B. Pritzker's administration. Prior to overseeing health and human services for the state of Illinois, she was the founder of the La Casa Norte, which is a not-for-profit focused on homelessness, and served over 30,000 youth and families. She has been a tireless advocate, and not only is Governor Pritzker lucky to have her as part of his team, we in Illinois are very lucky to have her. And then Dr. Suzet McKinney, who of course I'm privileged to call a dear friend and a board member on the Chicago Central Area Committee, is the CEO and Executive Director of the Illinois Medical District. And prior to leading the IMD, she was the Deputy Commissioner at the Chicago Department of Public Health. And Suzet has published a textbook on public health. I know she has taught and teaches at Harvard and is really instrumental to so much of what's happening with national security and public health, and was tapped by Governor Pritzker to lead operations for the alternate care sites, which I know we want to talk about what's happening with those. But so that gives you a sense of who we're speaking with. Could not ask for better guests, especially as we go into this holiday weekend. And we see states around us hitting the pause button, and tomorrow will be 1 week that we were lucky enough to move into phase 4. So let's start with, how did we get to phase 4? What does that mean? And how does the administration make moves backwards or forwards? Maybe the Deputy Governor can address that. Oh, can't hear you.
Okay, can you hear me now?
Yes.
Just trying to.
Okay, no, can't hear you.
Okay, thank you for having me. here today. It's a real pleasure to be with you and Dr. McKinney, who I've also known for years and worked with, and excited to continue to work together as we fight the pandemic here in Illinois. As you all know, the Pritzker administration came into office in January 2019, and of course, during that time, we're working diligently over the last year to build up our infrastructure. We began to rebuild Illinois in many different ways, and then COVID-19 hit. Can you hear me okay, Kelly?
It really sounds kind of muffled and distant.
Okay, is this better?
Suzette, what do you think?
Is this better?
Oh, that's better.
Right there. There you go.
Okay, sorry. Sorry for the technological challenges there. Okay, so over the last year, as I was saying, the first year of our administration, we're really working on rebuilding the infrastructure in Illinois, and particularly some of the areas of our administration and of the state that had really been dismantled and had a lack of investment for many, many years. And human services and public health were one of those areas where we've done good work in Illinois, but there was a lot of opportunity to do more. And then COVID-19 hit. And so over the last now, I think it's almost 15 weeks, right, that we have been fighting this pandemic since mid-February, we've been working diligently to protect and serve the people of Illinois. So how did we get to our Restore plan? We worked with experts from around the country, and then right here in Illinois, our own state team of epidemiologists led by Dr. Ngozi Ezike, who's our Director of Public Health, and the governor and his administration listened keenly, first and foremost, to the scientists. We also worked very closely with a group of epidemiologists at some of our major academic research institutions across the state. You can imagine who those individuals were, and they appeared on various different press conferences and in some of our press releases. But the governor listened closely to the scientists and to the modelers who were looking at where the virus was going and what it would take to bend the curve. We're all now very familiar with that term and what that meant. And as you said at the beginning, Illinois did a great job. So we listened, we stayed at home, we made steep sacrifices, first and foremost, economic sacrifices. Many of our families and our communities have taken a hit, but we also made social, emotional, and interpersonal sacrifices, not being able to be with loved ones at certain times, not being able to be connected, not have kids in school, and some of the disparities and inequities that has caused. But in so doing, we did bend the curve indeed. And so beginning on May 1st, we began to work on what we announced our Restore Illinois plan, and at that time laid out a set of metrics that we would follow over the next 28 days that would move us from phase to phase to phase. On May 28th, we moved to phase 3, and then on June 26th, we've moved to phase 4. And phase 4 is where we currently are today, and as we're all very familiar with now, phase 4 allows for more loosening and relaxing of some of the restrictions that we'd had in phase 1, 2, and 3. Primarily, first and foremost, we know our assemblies of up to 50 people are now allowed, and other elements around indoor dining, sports, activities, etc. I will pause there because I know we have a lot more to say, and I don't want to get too far ahead before we get into more questions.
Thank you.
Well, Kelly, I think this would be a good time just to add, based on what the Deputy Governor just said, I think her points about our administration and following the science are really important. You know, I've been seeing questions from people such as, well, why can't we just go back completely to normal? And I think all we have to do is really look at what we're seeing in many other states across the US. And we're seeing a lot of those states continue to surge in cases. And that is because there has been somewhat of a less focus on the data and the science. And so I think it just speaks to the leadership of our administration, certainly starting with Sol, our wonderful Deputy Governor, but also Governor Pritzker himself in not bending to some of the economic pressures and other pressures and really focusing on what would keep the residents of the state of Illinois safe. And as I often say in other talks that I give, to date, Illinois is the only state in the US that has met all 5 of the White House metrics for reopening. And I think that's really remarkable. And I think it speaks to the wonderful leadership that we've had.
Well, I see that we already have questions coming in. And I think, when we started planning for this conversation, when I would see on the national news, Illinois was in the top 5 states with the number of cases. And now we're not listed in the top 5 cases around, nationally. So I think it goes right to your point that we have been doing things right. And a lot of that has been the strict guidance about wearing masks, which leads to one of the first questions. It reads, why were shields deemed not adequate by themselves? Would have been a good alternatives to students who could not tolerate masks and for staff. Can you please answer that from a medical perspective? Well, again, I want to caution the audience, to the best of my knowledge, neither Dr. Suzet McKinney or Deputy Governor are medical doctors, but I don't know, ladies, if you have any thoughts on the shields?
Sure. I think
Yes.
the way that I would answer that question, I would remind the audience that the purpose of wearing a mask or a cloth face covering is to protect others from any respiratory droplets that you might exhibit or that you might expectorate as the mask wearer. Typically, when a mask or cloth facial covering fits properly, it covers the nose and the mouth securely around the face, and that is what prevents the release of respiratory droplets. Face shields are typically worn in the healthcare setting, such as a hospital, when there is concern or the possibility of bodily fluids being splattered. So when you wear a face shield without a mask, there is an opening at the bottom. So it still allows for respiratory droplets that are airborne to travel through the air and into your nasal cavities. Thus, it is a lesser degree of protection than a mask that covers both the nose and the mouth, if that makes sense. I apologize for my visuals, but hopefully it helps with the explanation.
Absolutely, that makes perfect sense. Deputy Governor, anything you would like to add to that?
Yes, and thank you, Suzette, for giving that fantastic and very clear explanation. Just the one small caveat I would add to that is that in the ISB guidelines, there are some allowances for particular student groups, those students who perhaps need to be able to read lips and or touch in order to be able to learn because of a potential disability that they may have. And so as part of the learning cycle, there's an allowance for face shields in those very specific instances.
Oh, that's excellent to know. Thank you. Another question, please clarify cases. Are these test cases? Are these positivity cases? Has COVID death counts been increasing? Has hospitalizations been increasing? What is actually increasing?
It sounds to me like perhaps that question came from my comments about what we're seeing in other states across the country. So I'm going to provide my response based on that. So if you look at many other states across the US, this has actually been reported pretty widely in the news the past several days. We are seeing cases, actual positive COVID-19 cases, not just increasing, but in fact, surging in many places across the US. The thought process from a public health perspective is perhaps that has something to do with reopening a little bit too quickly. But yes, we are seeing increases in positive COVID-19 tests in many states across the country, not just an increase in cases, but also a steady increase in the number of deaths among those positive cases. As opposed to Illinois, we are seeing the number of cases, positive cases that are reported on a daily basis decreasing. And in fact, and the deputy governor can correct me if I'm incorrect here, but the last data point that I saw, the number of deaths in relation to the number of positive cases here in Illinois was as low as 3%. But we're seeing other states where that death rate has not yet begun to decrease.
Well, yeah, I think that's right. And I would just add to that, while, you know, we said this at the beginning, we're very proud of all the shared sacrifice that Illinoisans have had. We are obviously very, very concerned in watching the increases around the country, including some of the states that border Illinois. We now know, right, this is a global pandemic. This virus knows no borders. It knows, you know, does it know to stop at the border of Illinois and Iowa? Does it know to stop between, you know, Indiana and Illinois? And so we are very conscious and watching very carefully what our neighboring border states are doing and where rates are going there. And we are upon a holiday weekend. And so I know that there have been announcements shared by various different municipal leaders as well as state leaders encouraging Illinoisans that for this fourth holiday that you try to celebrate with just your close household family and that you don't enter into large groups, and that you continue to abide by the 3 W's that Dr. Zike has shared so publicly, which are W number 1, wash your hands, W number 2, wear your mask, and W number 3, watch your distance. In just a few short days, we could erase many of the gains that we have had over this difficult 14 weeks. And so I encourage all of you who are on this line, you are clearly active in your community, you are leaders in your businesses and in your communities, please do share this information. We're closely watching this weekend as it's a holiday weekend. We're also going to see the more reopening of indoor dining, of bars, of other events that are happening. And we want to keep folks safe.
Dr. McKinney, just to clarify, I think I was a little confused by something that you said, and that is, I thought I heard you say that the number of cases are decreasing, but that's not what I thought I saw in the news. In fact, yesterday, I think it was a little over 800 cases, and just a few days ago, it was maybe 500 cases. So is it the percentage rate that's decreasing?
I was referring to the percentage rate in terms of the percentage of deaths in relation to the number of cases. Here in Illinois, it's down to 3%.
Great. And so I wonder if either of you could help us understand, if we have, again, upwards of 800 confirmed COVID cases in a 24-hour span, and we are still moving forward with phase 4. But next door in Indiana, they have around 500 cases, and they are now kind of hitting the pause button. So any ideas on these different approaches?
Sol, do you want to start?
So I'll start, and please, Suzette, build on it. So first of all, we're looking at the phases holistically, right? So not just one point in time. We look at 7-day rolling averages, and we've been watching the data officially for Restore Illinois, obviously since the beginning of the pandemic, but in terms of our Restore Illinois phases since May 1st. And some of those key metrics were to see decreasing positivity, right? So the number of positive cases going down, number of deaths get correlated with that, but then also where is our healthcare institutions? Where are hospitalizations? Are those decreasing as well? Are the number of ICU beds and ventilator use decreasing as well? And so those are some of the key metrics that we've been watching since the beginning, but also very carefully and publicly sharing those metrics with 100% transparency with the public since May 1st. As we have hit those decreasing measures over a 28-day period, and 28 days was chosen because it's 2 incubation periods for the virus of 14 days each. As we've seen those decreases, along with metrics of increased testing and increased contact tracing availability, those were the thresholds to move forward. So yes, we're continuing to have daily positive COVID-19 cases, but overall, the rates are going down, and we have bended the curve. We've bent the curve down. I'll pass it on to Suzette right now, and then if there's anything else I can think of, I'll add to that.
So I would just say to the audience that the Deputy Governor has explained that perfectly. I don't think that I could have said it better myself. I think what I will add is that, you know, in comparing states, you have to look at these same data points across different states. So some of the things that we are seeing here in Illinois that help us to feel comfortable remaining in phase 4, perhaps other states are not seeing that.
Dr. McKinney,
Yeah, and
go ahead.
So
please.
go ahead.
Well,
No, one thought that I'd had that I wanted to add on to that is the restore metrics are really also steeped in ensuring that we don't have a surge on our healthcare system that we can't manage. Many Americans saw what happened in China and in Italy and Spain, who fell victim to the virus prior to the states and Illinois. And, you know, you saw people languishing in hospital corridors or even unable to access medical care. And so some of these metrics are really also steeped in what can our hospital system manage, so that if you need to go to a hospital to seek medical attention in order to breathe, in order to live, in order to survive, you will have access, and that we have the capacity to manage that surge. What we saw over the months of March, April, and May is that our hospital system here in Illinois can surge, right? We worked very closely with hospital leaders to implement and create additional surge capacity, extra beds, extra ICU beds, additional ventilators in our states. We managed that. We used a portion of that surge capacity. And since the virus has come down, has decreased, we've also decreased some of that surge. So I know that we're going to get to that question at some point out there, but, you know, what do we do next? And certainly one of the lessons that we've learned that we understand very clearly is what is our surge capacity in this state, and how can our hospitals be best prepared to get there very quickly, and what are those metrics that we need to be looking at in order to prepare for that surge?
Absolutely.
Well, that is perfect, because that is the segue to a question for Dr. McKinney. And that is, given the work that you did as the Director of Operations for the alternate care site, excuse me, are there any preemptive measures being planned now in preparation for the feared second, potentially worse, kind of second wave in the fall?
Sure. So I think I'd start by saying the first thing that I pretty much say all the time when I talk on this topic is, if you know anything about the behavior, the typical behavior of pandemics, then I think we fully expect to see a second wave. That second wave could be less severe than the first wave. It could also be more severe. It depends on many different factors. So I would say the first preemptive measure that is being taken, as the Deputy Governor mentioned a few moments ago, is continuing to encourage the residents of Illinois to be diligent with those 3 W's. Because a lot of what we will see in a second wave could, or would, I should say, be heavily based on our human behaviors, especially if we reach a second wave prior to a specific medical countermeasure being developed for COVID-19, such as a vaccine. So I think that's one of the things that we're doing. I would say we are also continuing to monitor the data and the science and the situational awareness of what's happening across our hospital systems. Kelly, you mentioned the alternate care facilities. We are ensuring that we have a ready-to-go posture with our alternate care facilities should we reach a situation where our healthcare system needs some additional support in terms of surge capacity. And then I'd say the final thing that we are doing is we are watching very closely additional guidance that's coming out. I would say we're learning lessons from other states, seeing what's being done well and what's not being done well. Because when you look at situational awareness, from my experience in preparedness and response, you have to look broadly and use that information in your decision making. So those are some of the things that I see that are being done preemptively to ensure that Illinois is as best prepared for a second wave as we could possibly be.
Excellent.
Yeah, I just to build on that, because I think this is important for the audience to know, is that over time, folks have known that we've increased our testing capacity in the state, right? And so you saw us go from 2,000 to 10,000 to 15 to 20. And over the last 2 days, we've reported 30,000+ tests in Illinois. We're in the top 5 of tests per capita and testing capacity in the United States. And the governor has charged us with doing more. One of the things that we have done, and we're now in our second week, the governor announced it a little over a week ago, is our increased mobile testing capacity. And so what we are doing is standing up pop-up testing, if you will, in areas around the state that have had high positivity rates, where we know we need to get folks tested, and also creating opportunities for essential workers and other folks who are out there more frequently to get more frequent tests. The capacity of this mobile testing is also important in managing the second wave, because it allows us to deploy these mobile teams quickly to hotspots. So if we know of a hotspot that happened as a result of a backyard party, a bar party, you can imagine what could have happened, a church gathering, we can quickly get mobile testing there, along with the contact tracing. And so that's something that I'd like to just make sure we touch on really quickly, Kelly, with your audience. There's been a lot of news reporting about contact tracing, and just want to say that your data is private, it's privately held. We abide by HIPAA. Data is not shared with any other federal databases, like immigration databases, and it is important for individuals to share who they've been in contact with, so we can indeed then offer those contact opportunities to get tested, and then education around isolating themselves in order to protect themselves and their communities. It is those two elements also of testing and tracing that are going to help us be best prepared to fight the second wave.
That's great. We have a lot of questions coming in and only a few minutes left, so I'm going to read as many as we can try to get through. And one question is, if there is not a spike in positive test cases after the 4th of July holiday weekend, might Governor Pritzker expand the 50-person cap for some businesses like banquet halls, restaurants, indoor recreation, etc.?
I think I'll answer quickly, and I'll say, we are looking at the data week by week by week. We've just entered phase 4. So post the holiday, we will have not gone through the 2 incubation periods of 28 days, as I mentioned before. I think we'll want to very carefully watch that and see where we are. We also know, as we've laid out in phase 4, that this is where we're going to have to be for a while as we reach and as we get to comprehensive treatment and or quarantine as well. As Suzet McKinney said from the very beginning, as you have said, and as we're seeing in other states, the virus spikes quickly. We do not control the virus, right? We are at the mercy of the virus, and we can do things to stem it. So we're going to be watching the data very carefully with all of you.
The next question is going back to masks, because it really seems like wearing a mask has become very politicized. And there seems to be an expression of, if you don't wear a mask, you support one political viewpoint, and if you do wear a mask, you're on the other side of the spectrum. And so one of the question is, what resources would you point people to understand if masks are in fact really beneficial? And the question that kind of feeds into this reads, have you seen any specific data showing how much more effective it is to wear masks versus not wear masks in helping limit COVID spread indoors, on planes, etc.? Do you think it's safe to move to more than 25% capacity in restaurants and bars, considering that people can't keep masks on while eating before a vaccine is widely distributed?
So I'll start with that, and I would say that for our audience members who are looking for a specific resource outside of what our state health officials have already disseminated, look at the Centers for Disease Control and Prevention. CDC has an entire section of their website dedicated to COVID-19, and they specifically speak to masks. As a public health professional, personally, and I am speaking on behalf of Suzet McKinney and no other political affiliation or administration, I personally would not feel comfortable being in a scenario where there's greater than 25% capacity not wearing masks. I think that data and science around COVID-19 continues to evolve. And so I think we have to be smart. As the Deputy Governor said earlier, COVID-19 knows no boundaries. Well, that also means that COVID-19 does not recognize political affiliations. This is about safety and it's about health.
Great, thank you. And Deputy Governor, going back to your experience with housing, there's a question that reads, Illinois' housing is largely owned and managed locally, but interruptions in rent threaten their solvency. The governor's moratorium on evictions has created an untenable situation where residents who have not paid rent since the fall of 2019 are still living rent-free and abusing the system. What are the plans to modify or end the moratorium for these bad actors who do not have COVID loss of income, but rather are taking advantage of the situation? Is that something you can address?
Thank you. Yeah, just quickly I'll share. I know we only have a moment or two left. Just a couple of weeks ago, Governor Pritzker announced $300 million in CARES Act funding that will be distributed by the Illinois Housing Development Authority, specifically for rental and mortgage assistance. $150 million for rental and $150 million for homeowners, with the funds going directly to landlords and or going directly to the mortgage service companies to address both arrearages, current, and any future rent payments to avoid loss of, or to avoid eviction and or foreclosure proceedings. IDA is going to be releasing these funds utilizing an online portal beginning in August. And there'll be more information available shortly, but we expect to be able to impact up to 30,000 renters in the state of Illinois with this, and up to 15,000 homeowners. And so we are very conscious of the fact that, yes, there are a lot of small mom and pop families, and not just small, but mid-sized landlord and property management companies that manage housing, and they in turn need to make mortgage payments as well. And so the program has been designed with their input. We've talked to landlords, we've talked to landlord and renter and real estate associations across the state in order to get that input, as well as from renters and from social service agencies to understand how the loss of income has impacted folks. And so we think we've come to a good middle ground in being able to address this and get those needed mortgage assistance payments in the hands of landlords to be able to manage their own mortgage payments in turn, and for their own forms of income to take care of their families as well. So more to come on that. There will be press releases from the governor's office and from the Illinois Housing Development Authority.
That's excellent. And I know that we're running late, but I do want to make sure we get this last question answered. If everything goes well, what will trigger stage 5? When could we get there, and what needs to happen in order to get there?
Well, I'll start briefly and then Suzette add on. But I think you've heard us, you've heard, sort of national officials on this and local officials too. We need comprehensive treatment and a vaccine, right? Phase 5 is really what we were used to before. And unfortunately, what we were used to before is where the virus thrives, right? And so social distancing, masking, and washing our hands and being vigilant about that is the new normal. And I know a lot of us aren't comfortable with that term, but it's where we're going to need to hang out for a while here. And so we are carefully watching all the national data that comes out about vaccines and the vaccine trials. Illinois has been the recipient of remdesivir, which is one of the products that's being used in hospitals to treat COVID patients, and it has seen some promise. It's not a cure-all, it doesn't cure all COVID patients, but we have definitely seen some improvement in their conditions in being able to survive and of course, leave hospital care. So we are carefully watching that data, and then, of course, looking to see where our positivity rates go. Ideally, just like all of you, I want us to get back to a place where we feel whole, complete, where our businesses are thriving, where our communities are safe, where we can hug each other, right? I have an elderly grandmother in her early 90s, and I've been looking at her also through a window, and recently got to see her. And like many of you and many of our families in nursing homes, it's awful to feel so disconnected to the people that we love, but we know that doing this will protect us. And like all of you, I also don't want to go back. Right? We don't want to have to turn this car around, and we won't have to if we can all work on our individual behaviors and influence our communities, our businesses, and our families to do the right thing.
Well,
Absolutely.
that sounds like a perfect way
I
to
could
end
not
it.
agree more.
Dr. McKinney, any last comments?
No, I actually could not agree more with the Deputy Governor's comments. The only thing I was going to add, which she already said so eloquently, is that we do not want to have to turn around and go backwards. So what I would say to my friends, my family members, and my colleagues, we are in phase 4. Let's get comfortable. We're going to be in phase 4 for a while.
Well, thank you both for spending time with us today. It has been very, very informative. I know on behalf of our members and stakeholders, being able to ask these questions and get such direct responses, it really helps people understand what we're living through and where we, as you say, get comfortable. The best that we can hope for is where we're at now, probably for the long run. And it really is incumbent on all of us to do the 3 W's so that we stay in the best place that we are, which is right now where we are. So with that, I want to thank everybody for spending time with us. Next week, we will not have a webinar on Tuesday, but we will be back on Thursday, and we have Shia Kapos from Politico. If you're familiar with Illinois Playbook, Shia tracks what the decision makers, what's happening in government and politics. I know I start my day reading her newsletter, and I'm really looking forward to getting her insights. So I want to thank so very much Deputy Governor Flores, Dr. McKinney, for all the work that you're doing on behalf of the public and for spending time with us today. I wish everyone a very safe and wonderful, happy 4th of July, and I look forward to seeing you next week. So with that, I'm signing off. Thank you. Bye, everybody.